Assalamu alaikum everyone. I am third year student in the statistics department at Russia University. Today we will be discussing a critical public health challenges in Bangladesh non-communicable disease. We will explore the rising burden of non-communicable disease, the impact of lifestyle changes, challenges in our healthcare system, and potential strategies for interventions. Here is my selected paper. Now I am going straight to the next slide. Here is the abstract part of this paper. Non-communicable diseases have become a pressing public health concern in Bangladesh, accounting for approximately 67% of total deaths. The rising prevalence of non-communicable diseases such as cardiovascular diseases, diabetes, cancer, and chronic respiratory conditions is driven by urbanization, lifestyle changes, and an aging population. Changes in dietary habits characterized by increased consumption of processed, calorie-dense food and reduced physical activity in urban settings have significantly elevated non-communicable disease risks. Tobacco use remains widespread, affecting over 35% of adults, and rising alcohol consumption among urban youths exa- exacerbates the problem. Stress for economic and urban transition further contributes to the burden of non-communicable disease and related mental health issues. The healthcare system faces critical challenges including a shortage of trained professionals, limited resources, and high out-of-pocket costs for treatment, which often lead to financial hardship. Although the government national Non-Communicable Disease Strategy and Action Plan 2016 to 2021 aims to address this issue. Its implementation has been inconsistent. Public health interventions are vital for combating non-communicable disease, promising strategies including community-based programs to promote physical activity and healthy eating, educational campaigns, and regulatory measures to limit unhealthy food and tobacco consumption. The integration of mobile health initiatives has also shown potential in managing chronic diseases in resource-limited settings. Tackling the non-communicable disease burden requires a comprehensive approach involving strengthened healthcare infrastructure, public health initiatives, and community engagement. Prioritizing this effort can significantly improve population health and reduce the socioeconomic impact of non-communicable disease in Bangladesh. The objective is first point is understanding the prevalence and impact of non-communicable disease in Bangladesh. Secondly, examining lifestyle changes and risk factors contributing to non-communicable disease. Identifying healthcare system challenges in addressing non-communicable disease. Exploring public health intervention and policy measures. And lastly, discussing future direction and recommendation. The next slide is defining non-communicable disease. Non-communicable diseases are chronic diseases that are not transmitted from person to person. The four major types are cardiovascular disease, diabetes, cancer, chronic respiratory disease. In Bangladesh, non-communicable disease account for 67% of all deaths, marking a major shift from infectious disease burdens. And this slide is lifestyle changes and risk factors. First point is impact of urbanization on health. Rapidly urbanization has led to sedentary lifestyle affecting physical activities level, increasing in desk-bound jobs and reduction in outdoor recreational spaces. Secondly is dietary changes and nutrition transition. Traditional diets rice in vegetables, whole grains, and fish are being replaced by processed food, sugary beverages, fast food high in unhealthy fats. The rise in overweight and obesity is a key risk factor for diabetics and heart disease. And third point is tobacco and alcohol use in Bangladesh. Around 35% of adults use tobacco, smoking or smokeless form. Tobacco is leading cause of cardiovascular disease and respiratory conditions. Alcohol consumption, once low, is increasing among urban youth. And last point is mental health and stress factor. Urbanization and economic challenges led to chronic stress, anxiety, and depression. Mental health issues are closely linked with non-communicable diseases such as hypertension and diabetes. This diagram illustrates how lifestyle changes in Bangladesh are contributing to an increase in non-communicable disease. It highlighting five key factors. First of all, we see dietary habits that show the green color, increased consumption of processed food, high sugar, salts, and unhealthy fats. Second is physical inactivity that show blue color, more sedentary lifestyles, desk, bounce job, and limited recreational spaces. And third, alcohol consumption, orange color, rising alcohol use, especially among urban youth, leading to increased health risks. Fourth is tobacco use, red color, high smoking rates, which contributes to cardiovascular diseases and respiratory conditions. And fifth is stress, purple color, caused by rapid urbanization and economic transitions impacting mental and physical health. This lifestyle changes collectively increase the prevalence of non-communicable disease like diabetes, heart disease, and respiratory illness in Bangladesh. Next slide is healthcare system challenges. Here, first point is the current stage of non-communicable disease management. The Bangladesh healthcare system is still primarily focused on infectious disease. Many facilities lack specialized non-communicable disease care and resources. Secondly, is the shortage of healthcare professionals. Limited trained doctors and nurses for chronic disease management, insufficient diagnostic and treatment facilities in rural areas. Thirdly, is financial burden and out-of-pocket expenses. High out-of-pocket costs lead to financial hardship for many families. Many patients cannot afford regular medications or doctor visits. And lastly, policy gap and implementation challenges. The National Non-Communicable Disease Strategy and Action Plan 2016 to 2021 has not been fully implemented. Lack of coordination between government agency and healthcare providers. The diagram illustrates the key challenges in managing non-communicable disease in Bangladesh, ultimately leading to an ineffective healthcare system. It categorized the challenges into four major areas. First of all, healthcare provider shortage, orange color. The healthcare system faces a lack of trained professionals and insufficient staffing, making it difficult to provide adequate care for non-communicable disease patients. Secondly, high treatment costs that show yellow color. Many patients bear the burden of out-of-pocket expense, making non-communicable disease treatment financially challenging. This leads to a significant financial burden on families, especially for long-term chronic disease management. Thirdly, is inadequate facilities, gray color, limited resources, outdated medical equipment, and poor infrastructure contribute to inefficiency in diagnosing and treating non-communicable disease, reducing the overall effectiveness of the healthcare services. And fourth, policy and implementation challenges, blue color, weak policy framework, gap in policy excursion and implementation difficulties prevent effective non-communicable disease management, limiting access to consistent and high quality healthcare services. This combined factor create a major barrier to managing non-communicable disease effectively, putting strain on patient and the healthcare system in Bangladesh. Public health interventions. The first point is community-based program. A need for public awareness campaign on healthy eating and exercise. Community driving exercise initiative can be effective. Second is government regulation and policy. Stronger regulations and unhealthy food advertising are needed. Expansion of smoke-free zones to reduce tobacco consumption. Third is third is the role of technology and M-Health. Mobile health programs can help monitor chronic disease remotely. Text message reminder for medication adherence and lifestyle challenges. And fourth is case studies and success stories. Example of effective non-communicable disease prevention programs in other countries, how similar strategies can be adapted for Bangladesh. Future direction and recommendation. First point is strengthening healthcare infrastructure. Need for specialized non-communicable disease clinics and more trained personnel, government investment in diagnostic facilities are telemedicine. Second is expanding public health initiative, increasing school-based health education program, creating workplace wellness programs for employees. And third is call for multi-sector collaboration. Government, private sector, NGOs, and international organizations must work together. Partnership can help fund non-communicable disease prevention programs. And the key takeaway is non-communicable diseases are a growing crisis in Bangladesh. Lifestyle changes and urbanization are major contributors. Healthcare system limitation hinder proper non-communicable disease management. Public health strategies and technology can drive positive change. Strong policy implementation and community engagement are essential. Now, the conclusion is the rising prevalence of non-communicable disease in Bangladesh is a multifaceted issue driven by lifestyle changes, urbanizations, and inadequate healthcare infrastructure. Addressing these challenges requires a comprehensive approach that includes public health interventions, healthcare system strengthening, and community engagement. By prioritizing the prevalence and management of non-communicable disease, Bangladesh can improve the health and well-being of this population and mitigate the economic burden associated with chronic diseases. Thank you for your time and participation.
আচ্ছা, কারো কি কোনো কোয়েশ্চেন আছে? থাকলে করতে পারেন। আচ্ছা, যেহেতু কারো কোনো কোয়েশ্চেন নেই, আমরা জাস্ট 4 মিনিটের একটা ব্রেক নিই। আমরা 7:50 থেকে আমাদের সেকেন্ড সেশনটা শুরু করব।